Hello, I'm hematologist oncologist Dr. Tony Talebi. Today we're going to discuss gastric cancer, cancer of the stomach. I have the pleasure of being with a very good friend of mine, Dr. Ike Akinoli, Assistant Professor of Medicine at the University of Miami. Thank you for being here.
Thank you, Tony.
Ike, would you please explain what cancer of the stomach is?
Well, first of all, what's the stomach? The stomach is the reservoir where food goes into directly from the esophagus. It's located in the upper left-hand corner of the abdomen, just around this position. And cancer of the stomach is a type of disease when you have the cells lining the stomach, when they start overgrowing and turn malignant, and that means that they start invading through the normal tissues of the stomach, and they can from there spread to the lymph nodes, which are the little glands that help contain infections, and also they can spread to the other organs of the body. So it's a disease of the stomach.
What are the different subtypes of cancer of the stomach?
Now, there are different subtypes of cancer of the stomach. Number one is the adenocarcinoma of the stomach. That is the common disease that's referred to stomach cancer. Now you have other cancers that occur in the stomach, like the stromal tumors, which is the connective tissue, like gastrointestinal stromal tumor, and that's not what we're discussing today, basically. And you also have other cancers that can occur in the stomach, like lymphomas and myomas. But when you hear cancer of the stomach, it usually refers to adenocarcinoma of the stomach.
Okay, for the purposes of this discussion, we're discussing adenocarcinomas of the stomach. Do we know how those cells eventually become cancerous from normal cells?
Yes, yes and no. When you have cancer, when you have the adenocarcinoma, we actually think that is related to inflammation of the stomach. So for instance, you have an organism called H. pylori, Helicobacter pylori, that infects the stomach cells. Those organisms live in the stomach and gradually lead to inflammation. And with chronic inflammation, you have damage to the cells and you have ongoing repair of this inflammation. After some time, this repair becomes abnormal and the cells start overgrowing, and their growth is no longer controlled by the normal regulatory mechanisms in the body, and that is when they turn malignant and they form cancer cells.
I see. Are there any other predisposing factors to developing cancer of the stomach?
Yes, there are other predisposing factors, like high salt diet, nitrites, things in the diet like nitrites, nitrates, which come from things like seared food and burnt food. So those things can also predispose to cancer. Another thing that we know that predisposes to stomach cancer is smoking. So smoking predisposes to stomach cancer. Now, some things, cancer is usually due to interaction of the genes and the environment. So there are some things, some people that have stomach cancer that run in the family. So you have that familial component and the environment all playing a role and interacting to form cancer.
I see. Why is it that cancer of the stomach is more prevalent in Japan than the West?
That's actually an interesting question. We have various theories that we think explains why you have cancer of the stomach being more common in Japan than in the West. Number one, we think that the H. pylori in Asia might actually be a more aggressive subtype than the H. pylori that is in the Western world. And that has been demonstrated in some studies where some chemicals that confer increased aggressiveness on this H. pylori organism have been demonstrated more in the organisms discovered in the Western world than those discovered in the Western world. So that we think is part of the reason. Another thing is that we think that the genes, there are genetic differences between the Westerners and the East Asians. And again, even the way the cancer behaves in the East Asians is a bit different from the way it behaves in the Westerners. So stomach cancer is stomach cancer, but the way it behaves in one part of the world is not the same way it behaves in the other part of the world, and that confers some differences in response to treatment. as well.
I see. What are some of the signs or symptoms of cancer of the stomach?
The stomach cancer, like every other disease of the stomach, one can be asymptomatic because the stomach is buried deep down. So you might have cancer of the stomach and you actually have no symptom. And we have seen some people who have no symptom that present with advanced cancer. Now, the other symptoms that you can have is not totally different from the symptoms of ulcer. So when you have pain, you can have constant pain in the stomach, and you can have unexplained weight loss. And you can have patients who just notice that they are unable to tolerate certain type of food anymore. And you can have, in rare instances, you can have the patient vomit blood, or you can have darkening of the stool, black stool, due to the fact that they bleed inside and pass this blood in the stool. So those are some of the things that you can have in stomach cancer. So unfortunately, all these things are not very specific for stomach cancer. So you can actually have somebody who, you know, I mean, I'm not saying that everybody should run to the doctor if they start having pain in their stomach and all whatnot. But if you have progressive pain and all whatnot, and you have unexplained weight loss, then it's time to actually have yourself checked out by the doctor, because most of the time it might just be ulcer, but it could be something more sinister, and the earlier it's discovered, the better.
Very true. Now, you mentioned genetics before. When is it appropriate for family members to seek genetic counseling if one's been diagnosed with gastric cancer?
Actually, we do not routinely recommend genetic counseling for gastric cancer. Normally though, when you come in with a diagnosis of cancer, part of the duties of the doctor is to go through your family history appropriately and ask questions, specific questions about each and every member of the family, to see if there are other cancers in the family. For instance, some people have what you call Lynch syndrome, and you can have family members who have colon cancer or endometrial cancer, and they can present with stomach cancer. In such situation, genetic counseling is appropriate, and being evaluated fully by the geneticist is appropriate. And in other cases, like you can have association with breast cancer and stomach cancer. So the main issue is actually the family history. In the absence of a family history, we don't usually recommend seeking the geneticist unless the cancer is so unusual. For instance, if you have the cancer occur in a very young person, then you start wondering, could there be a genetic component? And then you have to remember something. Some people do not actually have the benefits or pleasure of knowing their family, and in that case you might also think, could there be family history that is just unknown? And in that situation, it might also be appropriate to seek genetic counseling.
When you say young, what is your cutoff age? 40, 50? When would you start thinking genetic counseling?
Tony, you're touching on a sore point here, you know. I mean, both of us are getting advanced in age, so the definition of young to me keeps changing every day. But I mean, if I see a patient who is 30-something, for instance, with cancer, it worries me. Most cancer patients are actually in their 60s and 70s and above, you know. But by the time I start seeing it in patients who are less than 40, in some cases less than 30. For such patients, I usually think, is there a strong genetic component to this? And I usually evaluate them for genetic components to their disease.
So we'll get to the treatment specifics in later videos, but just generally speaking, let's assume a patient has had an upper endoscopy, there was a mass, and it has come back positive for adenocarcinoma of the stomach. What should that patient expect coming up next?
The most important question at each time we have a new diagnosis of cancer is actually to think, can we cure this person? And if the patient has had the endoscopy, we would be thinking of that. Is it curable? So the first thing we do is to make sure that we appropriately stage the patient to discover the extent of the disease. And that brings us to the issue, how would we stage this patient? So the staging is a combination of we do a combination of tests. Basically, there are some few tests that we need for stomach cancer. Number one is an endoscopic ultrasound. The endoscopic ultrasound would always tell us, what we do is we put an ultrasound probe through the mouth into the stomach and use the ultrasound to to basically bounce some echo off the wall of the stomach to see the depth of invasion of the tumor, and also to look at the surrounding lymph nodes. That helps us know how deep it is and how much the lymph nodes are involved. Another thing we do is called a PET scan, especially in cases where we have no evidence of disease spread elsewhere. So the PET scan is actually very good at looking at the surrounding lymph nodes. We also do CT scan, we can do the CT scan. Usually we're interested in looking at the liver to see if there's any spread to the liver. But we also look outside of the liver to see if it's spread to other distant organs. And in some cases, we look at the bones. So we do combination of blood tests and imaging studies. I mean, I don't routinely recommend that we do a PET scan, for instance, for all patients. We just do it in some selected patients, especially when we think, oh, it's irresectable, just to make sure we do not expose somebody who has disease that has spread to unnecessary surgery. So once we finish the staging, then we gather all the information, and then we say, now, how do we take it from there?
Okay. Are there any diets that prevent cancer of the stomach, or should anyone's diet change once they've been diagnosed with cancer of the stomach?
Tony, this question is a very interesting question. I can tell you that almost all my patients want to know about diet. Mm-hmm. Yes, diet plays a great role in cancer, especially cancer of the food passages, from the stomach all the way to the colon. Now, a healthy diet actually is healthy and plays a great role in decreasing the incidence of cancer. So the diet, for instance, we've noticed that patients who eat more vegetables and exercise and actually have good control of their weight have decreased incidence of cancer, including stomach cancer and colon cancer and breast cancer. And we discovered that something like the Mediterranean diet, I mean, I'm using the word Mediterranean here, but then a diet based on vegetables and all whatnot, fruits, actually leads to a lower incidence of gastric cancer than a diet based in high salt, high nitrate diet, and red meat diet. So yes, diet plays a great role, and eating healthy actually improves the quality of life, not just from cancer, but also from other diseases like cardiovascular disease. So I always encourage my patients to modify their diet. Another thing, I mentioned smoking as being part of the things that increase the risk of stomach cancer. So by the time you also cut down on smoking and eventually stop, you also reduce the chance of developing cancer. And if you have cancer already, you actually improve the overall survival in those patients.
I see. Family members always ask us, should they also have an upper endoscopy if one has been diagnosed with cancer of the stomach?
That question is always something I answer with special interest. Do you know, when you have a family member come in with a new diagnosis of cancer, there's a lot of family stress and there's a lot of anxiety. And the first thing I actually do is to address that anxiety and stress that the family is going through. Sometimes I have to refer them to joint family counseling. At that time, the family members are asking themselves a lot of questions. Are we at risk or not? Remember, most of the cancer of the stomach is not actually familial. Most of them are sporadic, so we don't routinely recommend upper endoscopies for patients whose family members have been diagnosed with stomach cancer. However, in those cases where we have a genetic component to the cancer, then we actually screen the family members. So for instance, if you have a patient with Lynch syndrome or something like familial adenomatous polyposis, which I did not mention earlier, but it's a cancer, a familial cancer syndrome, Those patients actually need screening for stomach cancer, among other cancers that they need to be screened for.
I see. Are there any support groups that you typically refer your patients to?
Yes, there are support groups that actually work close with us. One of the support groups that we have here is the Community Cancer Network, and they're actually very, very active here in our South Florida community in Miami, and they have a lot of activities that incorporate cancer patients and their family members, and it helps them navigate the system. For my GIST patient, there is an excellent website for GIST patients that I usually recommend, which is gistsupport.org. And basically, we also have the internal support group here, which is our counseling service, like our Talebi center, that is very active in taking care of our patients, and we usually refer them to the Talebi center here, and they are very, very good in terms of plugging the patients to necessary support groups.
I see. Well, thank you so much. Thank you for watching. We hope this has been educational for you as well.